Good day, and welcome to the Plant Engineering webcast, Elevate EHS Performance Enterprise-Wide, sponsored by SAP. I'm Kevin Parker, your moderator. Happy to join you today on behalf of Plant Engineering Magazine. Here are some tips to help you get the most from today's webcast. If you're experiencing issues with your slides or audio, refresh your browser or click the Refresh Media button directly under the presenter's picture. You can control the volume by adjusting the volume on your computer or by adjusting the volume on the webcast platform. If you are having technical problems with audio or the slide presentation, click on the question mark at the top right-hand corner of the screen to access a list of system checks to try before contacting an online technician. If you do need a technician, type a message in the Ask a Question box and someone will get to you as quickly as possible. You can also type questions for our speaker using the Ask a Question box. The live Q&A session will begin after the presentation concludes. Today's webcast is being recorded. You will receive an email within a week with the link to the on-demand event. To download a certificate of completion, a PDF copy of the presentation, and other additional resources, use the Event Resources tab on the left-hand side of your screen. Those documents also will be available with the on-demand version of this webcast. I'm now happy to introduce today's presenter, Mike Censerada. Mike Censerada is a solution manager focused on SAP environmental health and safety applications. He is located in North America, but has shared global responsibility for EHS solution strategy, go-to-market activities, sales support, and other partner channel support. Altogether, Mike has more than 20 years of experience related to design, development, and implementation of SAP, EHS, and sustainability software solutions. Prior to moving into the Solution Management Group, Mike worked in SAP services as a practice lead, application consultant, and project manager for implementation projects across multiple industries. Thank you for joining us today, Mike. The floor is all yours.
Okay, thanks, Kevin, for the introduction. And I want to first talk through the agenda for today's session. We are going to spend some time talking about where we are today as it relates to the COVID-19 situation and how the EHS profession is impacted, what we are up against. And I say we, I won't pretend to be an EHS professional expert out in the field, but as a technology partner, I do feel that we have some ownership here to help enable those professionals in responding to the current situation and moving forward. So we'll talk through that. And then spend a little more time talking about the SAP EHS solutions, how it can handle or help handle the current situation, and also provide improvement outside of the COVID-19 situation for your general EHS practices, and talk about the path forward with an integrated platform that SAP EHS provides. All right, with that, again, just want to look at today, May 28th. You see there the numbers related to the COVID-19 infections, and unfortunately those numbers have probably gone up since I put them in about 12 hours ago. So the situation is still evolving. We do see that in some places, but not all, the trend has stabilized or maybe even is now trending downwards, which compared to a couple months ago when anywhere you looked, there's obviously new cases being reported by the minute. Now we have a situation where some places are seeing a different situation, and that obviously is relevant to the EHS professionals that are trying to understand what they need to do based on their locality or their enterprise. And finally, we do see some states in the U.S., right currently the biggest economy in the world. Some have started to reopen with changes happening every day there, and some companies are resuming operations. And so that kind of gets us into the next piece here, where we take a look at the status of the EHS profession in these companies that are are either about to reopen or they've stayed open through the crisis, and have had to modify almost on the fly what they're doing to kind of deal with the risks that are prevalent now. And the first thing is, at this point, these EHS professionals, they may be working remotely. They may have actual family members and colleagues that were directly affected by the virus. They may have their own job security concerns based on the performance of the company that they work for. All those things are weighing on them. In addition, there may be some pressure to reopen quickly if a state or their locality has decided to kind of reopen the economy. Company leadership may decide, okay, we need to now move, and the idea is that how do we do that? How do we get people back to work quickly? Well, something that might be up against that is the EHS workforce may have to deal with a general workforce that is right now not confident that it is safe to return. And so how do we create that confidence? With the right systems, the right processes, and so forth. And the backdrop to all of that is the feeling or the thought that, and we've kind of seen this in the last couple of weeks in the news, that if reopening happens for a certain facility, or even broader than that, if something does go wrong initially with that reopening, the facility itself may have to be shut down again. And we've seen examples of that in a couple of different industries here in the U.S. So that might be a little bit over dramatic in a way, but again, it's not that far off from what the EHS function is dealing with at the moment in various enterprises across the economy. So if we kind of then take that down a notch and we think more about the actual challenges and specific pain points that they're dealing with. First thing is, this is a completely new workplace hazard or biohazard that is now apparent in the workplace. Science is evolving by the day. There has to be determination of what can be done to reduce risk overall. But again, it's a new agent, it's a new hazard that has to be evaluated here. There may be asymptomatic employees that are coming back to work, or they're already at work, and so you cannot assume that you're just tracking illnesses and that's all you have to do to reduce risk. If it's a multinational corporation that the individuals work for, there may be different facilities in different parts of the world where maybe the sense of urgency or the exact situation is a little bit different. So the actions that are necessary from facility managers and EHS professionals and so forth also have to kind of be appropriate based on that locality. Different regional guidelines affecting testing and things like that. I've talked to a few customers and a few professionals where they're seeing some issues with distracted workers. In normal times where, let's say you have it's a power utility and you have crews that are out there and they have certain procedures and they have certain safety measures that are in place and they practice them regularly and they're focused on their job and they do it safely and they do it completely. They're seeing issues now where workers are distracted either by having to work from home, not being to be able to kind of practice some of the methods that they would usually use to stay safe, and all that's kind of coming into play to kind of increase risk that it's almost like different risks beside the infection risk that we're talking about here. So EHS professionals have to worry about that. Another example there is kind of anecdotal stories here that workers that are having to wear masks, who also have to wear safety glasses for their job, they're actually seeing issues where the safety glasses are fogging up as people are breathing, and that actually increases from an EHS perspective, that increases the risk of slips, trips, and falls in the workplace. To have glasses that may be sometimes foggy, and now the worker has to clean them, and so forth. So there's different things like that are coming up that are unrelated to the direct COVID-19 risk, but are things that people have to deal with now. I mentioned the evolution in the science and the guidelines. PPE shortages, something that just a few months ago it was not that much of a problem to say, for this job you need a mask, you need glasses, you need gloves, and so forth. Now, it's something that has to be almost looked at every day based on shortages that are occurring to say, okay, what inventory do we have of masks? What inventory do we have of sanitation chemicals and things like that? That, again, wasn't an issue a few months ago, but now is definitely an issue. And as far as acquisition of those products, inventory and storage and usage, all of that has to be tracked more closely because it's relevant for the EHS response to the COVID-19 virus. There may be new procedures now that have to be created, established, and employees being trained on for access control, sanitation, and so forth. And all that is really something that has to be done as soon as possible. Contractors and labs and things that the EHS professional may have utilized to kind of deal with their normal jobs, now they may be shut down based on the current situation, and there has to be ways to kind of work around that. And then finally, this is a health topic, and so workers are being they're being diagnosed in some cases. All the testing information overall is being tracked, and so data privacy concerns have to be balanced against making sure that communication is happening to all the right stakeholders in a timely way. So again, some of the pain points, some of the challenges that are now apparent in the workplace for the EHS function. And what this leads to is, or results in, is kind of a specific business need where these professionals need a way to assess the risk overall, the dispersion of the risk, the severity of the risk in different, whether it's locations, different job actions, and so forth. And then from there, once risks are identified, identify actions to mitigate those risks, track testing, track infections, and then communicate all that to the appropriate people. And you see a graphic there kind of below that we feel that the only way to really do this effectively at this point is to make sure there's tighter communication and tighter integration between HR functions, EHS functions, and operations. And by function, I mean the organizations, but also the systems and the data that are supporting these functions. Okay. So really, this situation is kind of driving a need for a paradigm shift. And what you see here is something that I kind of see in a lot of the customer discussions I have over the last 20 years, and it's kind of ebbed and flowed. But bottom line, we've seen the EHS function be a little bit separate, sometimes for good reason, sometimes not for a good reason, where, again, the systems, the data, the procedures, it's being handled within EHS, and it is affecting the rest of the company, and they're communicating that out when needed. But as far as on a day-to-day operational basis, EHS could be considered kind of like on an island, kind of separate from most of the enterprise functions that are occurring. And this is also from a system standpoint as well. But COVID-19 is kind of causing a little bit of a change in what's needed. And so you see, now there's new training requirements. There may be a new organization structure that has to be created to kind of handle the risks. Workers' comp tracking may need to be more closely associated to the EHS function. Labor relations, shift scheduling, things that EHS may have some influence on, and maybe it needs to see that sometimes. But it's even more important now when companies are talking about, well, maybe we do like a half shift and we then switch to another team in the afternoon, or things like that. And there needs to be sanitation in between, so the maintenance teams have to be scheduled correctly and use the appropriate chemicals and so forth. So all of that is now coming into play. And some other operational topics, again, new shop floor systems for maybe temperature checking for the employees, or cameras, or other new PPE above and beyond the masks. And it could be certain wearable devices that track social distancing. That has to be distributed to the employees. They need to be trained on it, and so forth. And you see some other things there. Cost tracking. Obviously there's a cost to doing all this, and so that's something that you want better integration with purchasing and finance and so forth. And finally, maintenance scheduling. I mentioned before that there might be new sanitation procedures. There may be new guidelines around which chemicals can be used. when they can be used, and things like that. Or even if it's other types of maintenance activities, such as putting up new barriers or signage or things like that, all now have or need closer influence and closer integration with the EHS function. And so bottom line, at this point, this is no time to have EHS on an island. So to kind of maybe step back a little bit from the COVID-19 topic for a minute, what we feel at SAP is that there is an evolution that can move the EHS function towards a more mature process, a more mature solution overall, not just for COVID-19, but in general. And we start on the left there. I mentioned kind of like EHS on an island. There are certain functions or certain departments where they may be using a point solution that's separate from their main manufacturing systems or ERP systems. There may be just kind of like spreadsheets and other basic tools that are being used to track basic data. But you see, as you move towards the right, you see an evolution where maybe there's a certain level of data integration that you start with. You're grabbing HR data, you're grabbing financial data, you're affecting purchasing, or you're grabbing asset information for equipment and functional locations and production units. All that can be made directly available to the EHS function to provide a level of enterprise context to make better decisions and more streamlined information coming in. Another step may be for process integration. So driving as far as participation and contribution, where the EHS function is now part of the workflows, or maybe even triggering workflows in other departments within the enterprise, whether it's, again, things like maintenance scheduling, or if EHS is tracking workers that are sick or injured, how does that data flow to drive certain processes or triggers inside the HR module to make sure that those employees are supported correctly and managed correctly. If you then move to the next step, where you're now getting into more of like analytics and driving a more mature solution overall, where predictive analysis can be done, or scenario-based analysis that you're again pulling data from across the enterprise, that allows you to make certain decisions reactively, but you can also kind of look at that information and start to identify new ways to do things based on predictions that are made. And then finally, you get to a point where the EHS function is kind of fully embedded within the rest of the enterprise and with the enterprise systems, and you can drive more of a continuous improvement process. And you see there overall on the total right there, three things: situational awareness, autonomy, and ubiquity. And we feel that these are characteristics of a very mature solution, where not only the EHS function, but corporate leadership, shop floor personnel, and all those in between, the systems and the processes are driving a level of situational awareness that's not necessarily available when there's disparate systems, disparate processes, and so forth. Autonomy, allowing the system to drive certain processes based on data that's available from the rest of the enterprise, and kind of streamlining the EHS function a bit. And then finally, ubiquity, making sure that all the information, whether it's through reporting or from the initial trigger of processes and so forth, all that system functionality, all that system information and insight is available on all types of devices at all levels in the organizations at any given time. And that's what we want to strive for with our SAP EHS platform. Okay. So now, talking about those SAP solutions and that platform, I want to go into some slides to kind of explain some functionality related to COVID-19, but also in the general sense around driving the EHS function. So first thing, just a little bit of history. SAP has been in this business for about 25 years. The focus initially was around product safety and stewardship. And then you see there, as the years went on, there's more of a focus on the operational topics, which is actually my main focus: incident management, environmental management, emissions, management of change, and things like that. 2010, there was a complete renovation of the product. And some of the functionality that we have today in our latest platform is based somewhat on that initial renovation that occurred. And you see overall on the right-hand side, the S/4HANA term. S/4HANA is SAP's latest enterprise platform. EHS is part of the digital core of that platform, and all of our functionality at this point is in there, available on-premise or through a cloud offering and so forth. And where we're going is, you see that kind of light blue there. We want to start moving towards a more intelligent solution. And I mentioned some of those attributes like situational awareness, ubiquity, autonomy. That's our move now with the platform. All right, just a comment around the platform itself from a technical standpoint. You see there, as far as dealing with the current situation and making sure that all the right information is available when needed, that the system's reliable, that the system data is secure, including the health-related data. We are part of that digital core of the S/4HANA platform, part of the intelligent enterprise, and EHS can leverage some of the characteristics of that platform, whether it's making sure it's globally scalable. The analytics tools are all enterprise-wide, so we can pull data together from all different places. Consistent workflow engine, consistent user experience, things like that. And you see some of the others there as possible. I won't go through each one right now, but bottom line, our functionality for EHS leverages that broader SAP platform in a good way. All right, so the objectives around the solution related to COVID-19, there's a couple things that we identified. The first one is we want to make sure that the solution can help the EHS professionals, or facility managers or whoever's driving some of this, be able to assess risks for infection and transmission, in the workplace. And I'll show a process flow here in a minute on what I mean by that. Identify at-risk employees, maybe some that are asymptomatic, and make sure that the appropriate measures are in place. Identify, communicate protective gear. We talked about masks. Other things based on the specific job that they have to do or the location that they're in. All of that can be set at that granular level to make sure the employees know what they're supposed to be doing, what they're supposed to be using. And then finally, the overall objective here really is to increase confidence in the workforce, when they do come back to work, if they're not there already, that the workplace is safe to return, that their employer has put in the appropriate processes, the appropriate systems to ensure safety, not only right now, but in the long term. The three products that are most relevant to this, let's say, solution overall, these are not our only solutions, but there's three here. One is incident management, where we would track all of the illnesses that are reported, whether or not they're confirmed as a COVID-19 infection. But this is the mechanism to track all safety-related injuries and illnesses and events through mobile apps or portal screens or other mechanisms. Another piece is health and safety, where we track all the operational risks, the infection risks, and all the mitigation strategies and the controls that may be put in place to reduce those risks. And then finally, occupational health. This is a module that it's kind of a subset of the health and safety module, where it will track all the at-risk employees that are identified through these other means, whether it's illnesses that are reported or the risks, and then drive testing protocols, track infections and diagnosis, and then the appropriate actions and kind of case management around that. And OH also enjoys additional levels of authorization and security controls that are in place for the data that's tracked there. All right, and from a process perspective, so I mentioned the three products or modules that are kind of relevant here. This is the process scope that we are tracking against. I see on the left-hand side, kind of the first stage of this is around something changed there. I'll just stay with that. The first couple steps there are all about risk assessment, and we've actually seen from some customer feedback in the past couple months, this seems to be almost the most important part of the process, and something they want to obviously focus on first before workers are coming back, to kind of almost take a fresh look at their workplace and their facilities and their job descriptions and job safety analysis and all those things to figure out, all right, what do we have to do? Where are the risks, and what do we have to do to reduce those risks? So that's from the first pieces here. The second kind of phase is around identifying at-risk individuals, again, through tracking illnesses that are reported or clinic visits and so forth. And then the third piece is kind of on the right-hand side there. You would get those at-risk individuals into what we call a surveillance protocol that would be specific for COVID-19. And those protocols are also regional, or let's say local specific as well. So a U.S. facility may have certain testing guidelines and protocols based on CDC recommendations or OSHA, whereas if you have a facility in China or a facility in Europe, maybe a totally different protocol that has to be followed. The system can track all of those separately to make sure that the right scheduling and documentation and the test types and all that are managed appropriately for the locality. And then you see again a couple of things there at the end, reporting corrective actions, tracking absences, those types of things that we can highlight. All right. So just to give an idea what the software actually looks like, I'll just kind of step through some highlights here. You see here an app that it was designed from the ground up as like a mobile app, but these same screens would be available, on a portal screen as well. It's all device agnostic. Around the first steps, this is an app focused on identifying the hazards in the workplace. And you see that's kind of like the first steps overall in the process. The second step here is around our main risk assessment engine. So this screen would drive all of the actual risk assessments being done, by the facility managers, by the EHS managers, and you track severity. This is where you start to track the control measures, making sure those controls are put in place correctly, and so forth. All that's done from this central screen here. The next step is around identifying at-risk individuals. So after the risk assessments are done, and maybe high-risk jobs are identified, certain groups of employees are identified that may need more frequent testing based on what they do on a given day. Again, illnesses that are reported or so forth like that. All that would lead to what we call a proposal list. And again, it's a running list in the system driven by all that other data that then allows the practitioners to go ahead and schedule, which is again the next step, schedule actual testing tasks, make sure that the employee knows when they need to be there, notifications are sent out and so forth to get the employees to take the test. From there, within that same occupational health module, you're tracking not only the schedule of the test and let's say the completion of the test, but the results. And this screenshot doesn't have the specific COVID-19 kind of result structure, but you kind of get the idea. When you map out your test, you would map out how you track and document results. All that will be there in the system, and then for each employee, this data is tracked in a secure way. An analytics output, just an example, one of about 70 different views that we have in the system. This is one of, I think this is, injury and illnesses per plant. So, tracking plants in SAP. This is just a basic bar chart around, some of the different conditions and illnesses that were reported. The same type of chart could be used for actual, confirmed infections and so forth. And this is, I'll talk about this in a minute, but this is a real-time view where you're not sending data to another software package or even a data warehouse or anything like that. It's straight from the database. All the authorization checks are in place. for the users, but anyone who has authorized to kind of open these reporting screens, they can slice the dice in data and get drilled down to the view that they want, all in real time. So, and that's across all EHS applications that we have. All right, so that was kind of the basic process, and again, some of the screen highlights around the software. I did want to also talk a little bit about what we're seeing in the market around shop floor systems, IoT, Internet of Things based concepts that are being put in place almost first. And knowing that the workers are coming back to work, we have to have something on the shop floor to track their temperature, to track social distancing and things like that right away. As we've talked to customers about some of that, I wanted to at least highlight that we see EHS and that basic process in the dark blue as almost like a backbone for what really is a more comprehensive response, where you have some of those shop floor systems. You have some of we have partners in the device that are device vendors that are driving some of these concepts around wearables that track social distancing, or wearables and mobile apps that track history for contact tracing. There's a partner we have that is doing air quality monitoring in real-time fashion that you may know that particles in the air and other parameters like humidity, temperature, and so forth, they can all affect the transmission risk of the virus through the air. And it affects how long the virus stays in the air, how far it travels, things like that. So we're working with a vendor around that because that data can help drive the risk assessments that the EHS professionals are doing, and eventually affect how they're planning out testing and other mitigation strategies. You see there at the top Qualtrics, which is an SAP product. That is a survey tool where you can push that out to employees and maybe track whether it's self-reporting of illnesses or how maybe information about where they've been, what they're doing, how they understand the processes that are being put in place, the new procedures and trainings and so forth. Just all that that customer or employee experience data that can be useful to the EHS practitioner to drive the process in a better way. So we feel that SAP EHS kind of provides that backbone. It's integrated with the rest of SAP. It drives those transactional steps in a certain way, in a secure way. But then there's these other pieces that are part of the overall thing, and we're working with different vendors to drive that. All right, let me see how we're doing on time. I think we're good. So just a couple comments on value. I've talked a lot about the integration approach, and I'll actually talk about further that in a minute. Driving better communication, better integration between the EHS function, HR, and operations. That is something that our EHS applications do very well at a data level, at a process level, and so forth. That same integration into the core platform of SAP allows visibility and control over PPE inventory. So you can directly work with the purchasing functions, with inventory management, with distribution and so forth to kind of track exactly what you have related to PPE and other materials or things like sanitation materials that may be needed. All that is visible now to the EHS person in real time as it becomes a source of truth within SAP. Reduce legal liability. We already see in the news there's been some initial kind of legal situations coming up where whether it's an employee's kind of pushing against the employers or even vice versa, the idea is that this system has a very strong recording system of all the data changes, everything is auditable within the platform, which in the long run can help companies kind of navigate legal issues, to be able to show what was done at the time, how things evolved over time, and so forth. EHS also provides really a broader capability. I mean, we're talking about COVID-19, but I'll talk about the overall portfolio in a second here. but really it was originally designed to track all workplace hazards. And so COVID-19, or the SARS virus that's kind of driving COVID-19, it ends up in some ways being, without the, maybe at the risk of minimizing it, it's really just another workplace hazard. Like other biohazards, like other safety hazards that are there in the workplace, and EHS professionals are dealing with that right now. And the EHS platform that we have, these applications, can help drive all of those, or kind of monitor all those and deal with all of those in the long run, if a company decides to kind of put this in place. And then finally, whether it's, you have to assume that there's going to be regulations that are derived and put in place based on the lessons learned from the situation, and things like vaccinations. If and when we have those available, the system that we have here allows us to track all of that as well. There's already functionality to track the regulatory requirements and all the tasks associated with that, and then vaccinations and any program that's put in place for that as well. All right. So just some comments. I've talked about integration. I just want to illustrate a couple items there. First thing is the overall portfolio that we have, and you see here, I've talked about a couple of these functions already, but on the left-hand side, it's kind of a commercial structure. There's 5 main products that we sell. Everything's a la carte. There's no commercial dependencies or technical dependencies between them. The dark blue boxes are kind of like the processes and capabilities within each product. And I won't go through all these today, but if I go back there, if you see here, there's a few that are, again, relevant to COVID-19. The first is incident management, where, again, we track the illnesses. And you see some other capabilities for that module, whether it's near misses and more of the safety-related data. Health and safety, a little bit broader scope. There's a whole process around improving and managing chemicals on site. In this case, there may be some relevant processes around tracking sanitation chemicals. We do know that OSHA is seeing an increased use of more, let's say, regulated chemicals that are, harsher and stronger to sanitize equipment and locations within facilities. But with that comes, new protective equipment requirements, new training, new procedures, and so forth. And so, that may be relevant for certain sites. I mentioned the risk assessment, industrial hygiene piece, and then finally occupational health. All of those are relevant for the COVID-19 response. But again, you see some other things we have there. As an integrated platform, all these items, all these processes share similar master data, similar action tracking engine, consistent reporting tools, maybe with a couple exceptions, but for the most part, similar or consistent reporting tools across the processes. And we have direct integration, as I mentioned before, with asset management, and human resources, and a couple other functions. All right. I think I've talked through this. Again, just when we look at integration, kind of 3 main levels of it. I've mentioned, I think, each one of these, so I'm not going to spend as much time on this. I did want to focus on this slide a little bit again. You see here the process that we talked about earlier. If I kind of overlay, if you look at the orange boxes now, these are specific points of integration that we have with the rest of the SAP enterprise system. And it can definitely enhance and bolster the process overall. On the left-hand side around risk, we would drive risk based on sources of truth around plant hierarchy, location hierarchy, equipment, and things like that. We can integrate with shop floor systems that are put in place. Some of the mitigation tasks or actions that are done, and some of the things that are put in place, there's a cost associated with it. So we have direct integration to the cost center assignments in SAP, and then plant maintenance, which is obviously a key one for us. Anything that's identified that has to be put in place as kind of like an engineering control or a physical change within the plant to reduce risk, we can drive that through the SAP plant maintenance work tracking mechanisms. So, and you see a few others there as well. On the right, workflow, We have direct integration to HR, so if you're tracking absences related to workers that have fallen ill, that can be done through the HR side or EHS as well. Again, you see a couple other points where costs can be tracked all within the direct system. All right. To illustrate that plant maintenance piece, again, an example, whether it's permit requirements, whether it's corrective actions from an incident, or in this case, you would see controls that are put in place based on risks that are identified. All of that can be driven in a two-way interface to plant maintenance. Work is done there by the maintenance teams, and then it updates the EHS system to say, okay, this maintenance piece or task was done. You can update your action that you highlighted on the EHS side to make sure that nothing's falling through the cracks. And I think the final slide, just wanted to talk a little bit about analytics. We could actually spend a couple hours on this, but just as a summary, and we can provide a lot more information and other documentation if there's interest. There's a different set of tools, or I'll say multiple tools, and even though I've kind of divided these up into different levels, whether it's corporate level view or EHS or operations, in reality, different tools may be used by different individuals at different times, and you may see some corporate level dashboards that are actually useful for the shop floor and operations. And so it really just becomes role-based authorization that is set within the system, based on what our customers need. But having said that, as we look to kind of design our analytics tools and our outputs, we did think about the three audiences here: corporate, practitioner, and operations. And there are some tools that are kind of specific. There's some data tool, like kind of explorer tools, that's more like tabular reporting, formatted outputs like OSHA forms and other regulatory forms. There's a tool called Analytical Path Framework, and another one called Smart Dashboards, which allows more of a end-to-end view of the EHS processes and more of the ad hoc filtering and drill down reporting that the practitioners may need. And then we do have content within a product called Sap Analytics Cloud, which again is kind of a real-time dashboarding tool that it's a little more structured, a little less ad hoc, but provides again important real-time information either at the corporate level or it may be dashboards that a customer or a company wants to provide to all employees, where they can go to a dashboard and kind of see the performance of the company or certain aspects of the EHS function. So again, just wanted to highlight that there are multiple tools. All of them are in real time. So again, you're not pulling from separate systems or data warehouses and things like that. All right, so just some takeaways. First thing, kind of just keying off of what I just said in the previous slide, we want to make sure with this platform that critical information is available at all levels, shop floor to top floor, in real time, and we think that helps to kind of drive the safety culture. And specific to COVID-19, again, things are changing by the day. So as long as it's within the data privacy rules, you may be compelled to almost like overly communicate. And the system can help to do that based on how it's structured and those analytical tools that I mentioned. We drive the platform in a way where we can pull in data from different shop floor systems, whether it's there's some SAP tools, but also third-party tools for data historians and IoT devices, whether it's in the shop or whether it's a wearable on a person. There's ways to kind of get the data in there. A couple other things, with the integration that we have, we want to establish one source of truth for all employee information. We can tie back to all the HR data within SAP, and that obviously helps the EHS practitioners, drive the risk assessments, identify who's at risk, and then track the infections appropriately. And then kind of along those same lines, for the responses and let's say the actions and the measures that are put in place to kind of deal with this crisis, our platform kind of allows the EHS function to be embedded into other established processes. Here it mentions HR, but it's really that plus operations plus finance and so forth. All right. So with that, I think I'm done the main presentation part of the session, and we want to now move into some Q&A.
Well, thanks, Mike. That was a very thorough presentation, and we thank you for it. To our audience, type your questions for Mike in the Ask a Question box on your screen. We will get to as many as time allows. Questions that we don't get today will be posted online with the archived version of the webcast. And remember, to download a certificate of completion, copy of the presentation, and other resources, use the Event Resources tab on the left-hand side of the screen. Now, Mike, coming back to you, I knew the first time I received a briefing as a journalist on best practices for essential manufacturers, and they were presenting to the audience of 200 manufacturers all told. Their self-assessment paper and their different paper-based documents that they were using in the initial stages of this crisis to manage it. But it was, it was a little bit disconcerting because it was almost like something from the 1980s, but that has certainly changed very quickly. Will you be embodying actual recommendations for manufacturers using the solution on how they can best bring the workforce back into the plant, as it were?
Good question. I would say that it'd be kind of maybe a middle ground between driving a fully prescribed system versus talking to the managers and the stakeholders at that facility or within that customer to identify what they're specifically dealing with. These applications drive kind of a basic process, but they're in some ways kind of an engine where, if you have certain tests, I mentioned when I talked about like testing protocols, we're going to have to figure out, well, which countries or which localities does a customer operate in? And we want to make sure that the system, which can drive the protocols, let's say generically, you just want to make sure that the data is put in to account for those local requirements that might be apparent. So it's a little bit of a middle ground. We think we can drive an integrated transactional process along with all the analytical outputs. But when you get down into things like specific test types, specific protocols, maybe the jobs that are done at a specific facility and the job safety analysis that may have been done years ago, and maybe taking a fresh look at that based through the lens of COVID-19, we want to make sure we don't overprescribe and that we kind of tailor the system to match what these companies are doing, what they specifically have to deal with around COVID-19.
Right. I mean, I think that'll be especially appropriate when you're talking about decisions related to risk or decisions related to privacy. I believe I read it right in the beginning that employers had to be concerned whether they could reveal to their employees who exactly was infected and who wasn't.
Exactly.
And other types
exactly. And there's regional differences as well. If you look at European laws versus, let's say, U.S. or other, there's nuances, there's differences that have to be kind of managed, and the scalable system we have kind of helps with that. But there is, as you go through, you can configure some of those rules to make sure that every locality is managed correctly within the system. And maybe a comment on our ecosystem. Again, I represent the software vendor. We have partners that are, let's say, system integrators. We also have partners that are EHS domain experts. And we try to foster collaboration between all these partners to their relative strengths. So there's partners that can stand up the system from a technical manner and do that very well. There's also the engineering teams that can work closely with the business, with the EHS practitioners, the shop floor personnel, and others to make sure that it's kind of tailored exactly the way they need it, and that all the users of the system understand how to use it, and that they're getting the value that they need.
Good. One of our listeners asked, has OSHA published back to work policies for COVID-19? And I would open that up a little bit and just say, where do you turn to, Michael, in terms of looking for information about how this is going to intersect with your software?
Mm-hmm. Mm-hmm. So for that question specifically, and then I'll kind of address the second part of your question. OSHA has put in place, they haven't gone as far as regulations, and again, as far as our audience here, some of them may already know some of this, but they have put out certain guidelines for certain industries, and I think each week they're adding more. And OSHA is just one entity. If we focus on North America for a minute, OSHA is one entity that is, putting out things as the science permits and as their analysis and feedback from companies and governments and so forth as that comes in. Even CDC guidelines, they obviously have to make sure they're adhering to what's coming from CDC. But there are other entities as well. One, I'll kind of give a plug here for, there's an association, it's the AIHA organization, American Industrial Hygiene Association. They've also put out guidelines, again, based on industry, based on, let's say, certain job types and things like that, where whether it's engaging the employee and making sure they understand what's happening, or it's more about the operational side of putting in physical controls and things like air filters or plastic barriers or all those types of things. They've started to put those out in the past month, and as far as how and again, there's other organizations as well. I mean, there's many different industry organizations that specific to oil and gas or retail or others, where they have their own view of how this needs to be for their customer base or their audience. As far as how I track all this and try to funnel this into our strategy for the product and for our go-to-market, again, AIHA, there's a very strong level of expertise there, and I'm a member there and drive. There's forums and other ways to kind of see communication between all these top experts and interact with them to gain information on what they're seeing. Really, what is now kind of it's almost like a new front line. It's obviously not the same as the frontline workers when we talk about healthcare in the hospitals, but you now have EHS practitioners that are going to have all these employees come back to work, and right from the first day, things have to really things need to be set up, or else there could be, again, as I mentioned earlier in the presentation, another, let's say, outbreak at a site that could shut things down again. So it's almost like a new front line in this battle, and so you're seeing all the different organizations, different practitioners kind of share information in real time to provide lessons learned and best practices and so forth. And so I kind of try to I get involved in that as I can.
It's interesting because we see people in the engineering ranks that we write for and people on plant floors that we write for. They tend to be in their mid-40s or their mid-50s in terms of average age. So it's certainly as relevant for them as it is for anyone. But I'm going to ask this next question from Mary, and there's an acronym. I'm not sure what it is, but I'm just going to take a chance and suppose that you do. Mike,
yes, the JSA, the Job Safety Analysis.
You got it. Do you see COVID-19 protocols becoming standard?
Yeah, I mean, it's with the impact that we've seen only in the last 2 months on the workforce around the world, and no, without getting into all the politics or anything else, it's we don't know when we're going to have a vaccine, and even if a vaccine really will do the trick right away. And so, and there may be certain waves of this that come if we assume kind of a worst case scenario. So what's going to happen over the next few years is a little bit of a focus around this. I think, safety professionals in general and the EHS practice has done a great job in the last, I'd say 20 and maybe 30 years almost in reducing incident rates, understanding, risk exposure risks for chemicals and other hazards. Over time, incident rates have fallen for the most part, and worker health has gotten better. but now this is kind of like a whole new hazard that has to be dealt with, and it obviously, it's spreading faster than maybe other biohazards that may be apparent in the workplace, like flu or things like that. So I won't say it may be standard, but it's going to have to be part of JSAs in the future. Companies are going to have to go back, and I use the term, take a fresh look. They're going to have to look at their existing risk assessments, their existing JSAs, and their existing, processes and job descriptions and all those things, and try to figure out, all right, how do we put in some, based on the lessons learned from this initial, pandemic impact, how do we change things, and then how do we get the workforce confident that we've got everything in place when they come back to work, based on the changes that we've made. And we feel that, and it really not just the SAP software, but other EHS, products that are out there, some of our competitors. I mean, that's what we're all trying to figure out, is how can software and IoT wearable devices and just overall solutions in general help deal with that question.
Good. Well, let me ask you 2 questions in the conclusion of our webcast today, and we've got about 5 minutes left. And the first is more kind of the short-term reckoning that you've just been speaking of, in terms of any tips for our audience on how to balance fears and precautions against the urge to get back to it.
So again, I don't want to pretend to be an EHS professional out in the field, but again, I've, based on experience of dealing with all different industries, different size companies, and so forth, different regions, I think the first thing is, once the data, let's say the data privacy concerns are, figured out, that how much communication is allowed in different scenarios, I think communication is it's kind of like the first thing, making sure that within those guidelines, within also, corporate policies, which may further kind of influence what communication goes out to employees, you would want to make sure that information is available to all workers, and part of that is, let's say, current status, but also communicating what's being done to reduce those risks, including putting in software systems that may be new, putting in new procedures, explaining how those new procedures are going to be rolled out, how the training is going to be done to make sure all the employees understand the new procedures. If there's new requirements like wearing masks, just kind of dealing with all that change that's going to be occurring in the right way. And it starts with, again, almost like over communication within the guidelines of data privacy and things like that.
Good.
Go ahead.
Go ahead, Mike.
I was going to say, I see a couple other questions in here as well that are maybe pretty quick, but what were you going to ask?
Well, I was just going to say, longer term, am I safe in assuming that you feel at least many of these steps that are being taken will be permanent to one degree or another?
That's a little tougher. I mean, I think there's going to be, in this first reopening, let's say, whether it's companies are going back to work right now or even a couple months from now, whenever that is happening, there's going to be lessons learned that come from the reopening. And so certain things are going to be put in place, like temperature checking and the masks, and again, even new systems like what I've talked about today. But there will, once those are up and running and everybody's back to work, there will be lessons learned from that. It's not going to be, let's say, a perfect solution right away. And so you have to assume there's going to be some change. And so the word permanent might be kind of tough to kind of commit to, but you have to at least say that, right now, that we know things are going to change, for sure. Whether certain methods or certain tests or let's say protective measures that are put in place right now are the ones that will be there, for eternity. That I can't say. I'm sure.
That's great. Thank you so much for giving such a thoughtful answer.
Yep.
I do have one quick question for you. You mentioned fogging glasses, and one of our listeners has asked, do you have any suggestions pertaining to fogging glasses?
Again, I'm not the equipment guy, but I highlighted that because, and a question came in, but I've heard of that anecdotally multiple times now, where it's like, okay, you're forcing everybody to wear a mask. Well, certain individuals have to wear safety glasses, or even if it's just normal eyeglasses. And say, okay, this is going to lead to, at a minimum, it's going to lead to inefficiency because they're cleaning glasses, but it does lead to a safety risk that is now increased, because if they're doing certain work with their hands, or they're walking through a certain area, glasses fog up a little bit. You kind of have to assume that it will increase the risk of someone tripping or slipping or falling, right? I mean, that's how an EHS professional has to look at this. Whether that actually bears out in the evidence, I don't know. It may be a kind of a low probability risk, but it's something they have to at least think about. So it's a good anecdote to what we're dealing with right now around, it's a new paradigm right now. It's like, how are all these things coming in, and how the EHS professionals reacting to it in real time? And it's just
all right. Thanks so much, Mike. That's all the time we have for today. Thanks for the great questions. Thanks again to Mike Censerada for sharing his time and expertise. I'd also like to thank our sponsor, SAP, for sponsoring today's event. And now that we're just about done, we want to hear how we did. The exit survey will pop up on your screen as soon as the webcast ends. Please take a moment to complete it, because we use this information to improve our webcast. Finally, on behalf of Plant Engineering and SAP, I'd like to thank you all for attending. This concludes our webcast. Thanks, and we'll see you next time.